continuing to look at methods described in historical osteopathic texts. We're looking again at work from McConnell, giving 3 options as far as how to work on thoracic and lumbar soft tissue, very generally speaking, especially in relation to the vertebral column. The first one, he talks about essentially the patient's on their side, you stand in front of the patient, you reach around and with your hands. He talks about like an outward and rotary motion, or some particular way to frame this that maybe doesn't correspond with how you would actually do it, but basically what you would do is you'd grab, right, so he may be talking about, you know, upwards with both hands and rotating the hands, but you're going to pull the erector mass away from the vertebral column. Now the thing, I'm exaggerating this on purpose so that you can see his body move. This is working on the soft tissues, right? A little bit more exaggeration of that. Should I want to take the soft tissues farther? It's just a curl of the fingers. If I control his body by putting my forearms on a little bit more, I can maybe pull the soft tissue more. However, if I just randomly pull, I will get the soft tissue to a certain point, and then I will create motion of the whole body, which may not be my intention. So you want to be careful with that. So contact is control, and control is safety. So the more contact with my forearms, the more I can control the body, right? So I can pull on the soft tissue and keep the body stabilized just with my forearms. The other deal is that it's relation to motion. So in a relative sense here, what you're trying to do is keep the bones still and move the soft tissues in relation to the still bones, right? So then I can move up here, work that way, work further up. So that's one. We'll have you sit up and face me. The other one, another one that he talks about is having the patient seated. He does say on a stool, but for the purpose of this video, it's perfectly acceptable to do it on while the patient's sitting on the table, right? So what he talks about is being in front of the patient and essentially reaching around them to work on their thoracic and lumbar soft tissues. He doesn't necessarily say put the patient's arms on you or put the patient's head on you. So you could do this with putting the patient's head on your chest. You could do this with putting the patient's arms over your shoulders. You could do this with the patient putting their arms up and then resting their forehead on their hands, which is what I'm going to do. So just pull like this, right? Move the legs a little, right? So then you basically bring them towards you. You reach around. So depending on the size of you, like the size of your arms versus the size of the patient, you can do this with ease or great difficulty. But here, right, you identify the SP, you move to the side, you've got the soft tissues on some level, right? This becomes much more difficult the further down the body that you have to go, just based on the length of your individual arms. But that's one way to do that. That hold is often utilized for ribs, as well as extension of the vertebral column. To what degree that's ideal is questionable, but essentially in that situation, the thing that stays still is the patient's arms, relatively speaking. Almost everything else moves. The bones and the muscles do have some movement as I lean, so it's somewhat difficult to be convinced that you can target the soft tissues well. It doesn't mean you can't work on the soft tissues, but it's a bit of a messy method for aiming specifically at the soft tissues. The final method, he talks about standing behind the patient. Right, so in this case, I'll sit down just so that I'm fully in the frame, using your thumb, right? Actually, I'll have to flip a little bit, but just for this point, using your thumb on the erector mass and the side of the shoulder on that side of the patient, right? So essentially, he's talking about controlling the scapula in order to basically soften or bag the area, and using the thumb. Now, he doesn't say the point of the thumb, he doesn't say a thumb bar, but essentially you would intone that you would probably be better off using a thumb bar because you'll have more contact with the tissue. So what that would more or less look like would be here, right? So I can go here, push, and then I can bring to that side, bring to my side. It's essentially what he's saying. So I can have a relatively still muscle, right? And then a moving shoulder, right? I can have a moving short lever hand, right? But basically you more or less look like that, right? Now, you can grab the shoulder in different ways, but I wouldn't say that it's particularly ideal. But more or less what he's saying is use the thumb bar and move the patient's shoulder. So it's a relatively still muscle moving bones, so you can basically move the patient's torso, right, move the vertebral column against that relatively still thumb. So it's a still muscle moving bones.